When I first met Susan, she presented with a diabetic foot infection and wound on the bottom of her first metatarsal. With her being diabetic and having neuropathy, she didn't know she had an underlying wound until it was too late. The infection reached her bone, and so initially we took her to the operating room to get rid of the infected bone, take cultures, the standard practice that you would do for infection. Once the infection was cleared, we brought her back to save her joint by putting on a mini external fixation device. And then for wound healing, I was able to suture Restrata onto the wound because I wasn't able to close it at all. And so she healed wonderfully, functional foot, no scar. The reconstruction of that tissue is phenomenal. Unfortunately, Susan developed another wound on the lateral side of her foot, which affected her fifth toe and her fifth metatarsal. Because of that infection, we amputated the fifth toe and the fifth metatarsal. To prevent any deformity, I also did a tendon transfer once the infection was cleared. In this case, we were able to utilize Restrata in its second indication approved by the FDA for soft tissue reinforcement. So I was able to close that incision and amputation site, and I reinforced that area with Restrata mesh so that she wouldn't develop a wound dehiscence down the road. Successfully, she was able to heal both wounds and keep it from recurring. So what made Susan's care challenging was that she is very active on her feet, even being in her 70s. She's still working as a physical therapist, which is very job demanding. So being able to see her not only walk again, save her limb, but still be very active as a physical therapist and not have that wound recur is as successful as you can have a case.
Getting back to work was my ultimate goal. When I'm working with patients, it's when I'm happiest and comfortable, so I can hopefully make a positive change in their life to get them where they want to be.
So this is actually the type of graft I used on you.
I started noticing an improvement in the healing with the Restrata on a week-by-week basis. You could watch natural healing. You could watch the edges. It would heal from the periphery to the center, and it was working.
With this experience with Susan and getting her to heal not only one time, but 2 different times, 2 different infections, 2 different uses of Restrata, it's now permanently in my toolbox when it comes to challenging wounds and even acute wounds that may not be challenging but need advanced therapy.
I would not be here if it wasn't for Dr. Saysoukha and Restrata. I don't think I would have had the good outcome that I did if I had not had both of them in my corner. I think life would have been different. I'm very grateful for both of them.